Hello, I'm Dr. Hotze, and I wanted to visit with you about a common diagnosis which has a very simple solution. Oftentimes, individuals, as they mature, begin to feel low energy levels, they get difficulty with weight, they don't think clearly, they don't sleep well, they have joint muscle aches and pains, and they have some mood changes. They may feel low, down, discouraged, disappointed, distressed, depressed. And this usually accompanies these other symptoms. Well, oftentimes when the individual goes to the physician labels these symptoms as her diagnosis and says, "You're depressed." That is really not a diagnosis, it's a label. The question should always be, if I am depressed, why am I depressed? What's going on? Could there be any underlying physical cause to cause me to be depressed? Well, a very common physical cause of feeling low, blue, down, or discouraged is hormonal imbalance and hormonal changes, particularly low thyroid. The thyroid hormone in the neck produces, the thyroid gland in the neck produces thyroid hormones, which are secreted into the blood. They don't do anything in the blood, they have to enter the cells. In the cells, the active thyroid hormone enables your power plants in your cells, the mitochondria, to produce energy. So the thyroid hormone activates the power plants within the cells that produce energy so that your cells can function well and optimally, and you can feel well. If you don't get enough thyroid into your cells, you don't produce enough energy and your metabolism goes down. Everything goes down. You don't think as well, you don't feel as well, your weight goes up, everything else goes down. Joint muscle aches and pains, your thinking process goes down, and you can get the mood swings. So the diagnosis of depression should always be considered really a label, and we want to get at the underlying cause, why people feel down, blue, or discouraged. If there are no life reasons for that, very commonly it can be due to hormonal imbalance and decline, particularly thyroid hormone. So think about that. And we use desiccated thyroid hormone. We don't use the synthetic. So if you're on synthetic thyroid hormone and still feel depressed and have all the symptoms of low thyroid, you need to consider getting on desiccated natural thyroid.